I'd like to welcome you all to our Tuesday 1:30 p.m. session today. And we have Robin, once again, from Legal Counsel for the Elderly, doing a session on the Medicare Part D coverage changes. So without further ado, Robin, if you could introduce yourself and your topic for today. Thank you so much for coming on, and we appreciate you joining our session today.
Thank you, Alex. I'm so excited again to be here with all of you. Let me take a moment and share my screen. I have a presentation for you all about the Medicare Part D subsidy changes that you may have heard about. And again, for those of you who are seeing me for the first time, my name is Robin Griffin. I'm a senior attorney here at Legal Counsel for the Elderly. And I just want to welcome everyone for joining today. Today, we are here to cut through the noise and misinformation surrounding Medicare Part D. Many seniors have heard and seen the headlines suggesting that, Medicare Part D subsidies are ending, and they may be worried that their Medicare drug coverage is disappearing. But the good news is that most of what you've heard is either incomplete or misunderstood. So by the end of our presentation today, you will understand what is changing, what is not changing, and what steps you can take to protect yourself. Now, before we get into the meat and potatoes of the presentation, I don't want to assume that all of you have seen me before. So for those of you who have met me before, this will be a refresher. For those of you who are seeing me for the first time, I want to share some information with you about legal counsel for the elderly. Legal Counsel for the Elderly provides free legal and social work services to older adults who are in need. Our dedicated team works tirelessly to empower, defend, and protect vulnerable seniors. We work to ensure that seniors have access to the rights and resources that they deserve, from helping with housing issues, securing public benefits, or addressing financial abuse. Our team is here not just to offer legal advice, but a lifeline to those who need it most. Through our efforts, we're able to make a tangible difference in the lives of many seniors throughout the district, whether it's advocating for better health care, ensuring that seniors receive their rightful benefits, or simply providing the legal assistance needed to navigate complex systems. I mean, if you've ever tried to call Social Security or renew your SNAP benefits or QMB through DHS, then you know how complex these systems can be. So, Legal Counsel for the Elderly, we're here at every step of the way. We're committed to defending the rights of older adults and ensuring that they get the benefits they deserve. Now, we've been doing this work for about 50 years. And again, we're providing free legal and social work services to vulnerable seniors in need. Our team works tirelessly to address the most critical aspects of an older adult's life, and this includes housing, economic security, self-determination, and health and safety. Whether it's helping a senior stay in their home or securing benefits they've earned or ensuring their right to live with dignity and respect, we are here to provide legal expertise and compassionate support. All right. Now that we've gotten that out the way, you know I'm attorney Robin Griffin. You know where I'm from, legal counsel for the elderly. Let's get into what we're going to talk about in the hour. So I know many of you have seen the news reports, social media reports, maybe an email chain or an article discussing Medicare Part D and prescription drug coverage. Many people have contacted our office and they have questions. They're asking, am I going to lose my prescription coverage? Is Medicare Part D ending? Is extra help going away? Will my medications become unaffordable? What does this announcement mean for me? And these are all reasonable questions. The challenge is that some of the headlines have been confusing. Some articles use the word subsidy without explaining which subsidy is being discussed. As a result, many Medicare beneficiaries believe that programs that help low-income older adults pay for medications were on the chopping block to be eliminated. Today, my goal is to separate fact from fiction. And so by the end of the presentation, you should understand what actually changed, what did not change, what protections remain available, and what actions you should take in open enrollment coming up in October. Most importantly, I want everyone to leave here today feeling informed rather than frightened. So let's start with some basic Medicare background before discussing the recent announcement. Now, let's start with Part A. We may or may not know, but Medicare Part A will help you to pay for your hospital stays. Medicare Part A will help you to pay for skilled nursing facilities and hospice care if needed. Medicare Part B will pay for your doctor visits, your outpatient care, and your preventative services. And when I say preventative services, I mean like your mammograms, your colonoscopies, the yearly tests that you have to get to maintain your care. Now, Medicare Part C, it's also called a Medicare Advantage plan, where they combine Medicare services through a private um, insurance company. All right, one moment. Oh, thank you, Alex, for putting that number in the chat. Yes. If you have any questions about Medicare or any legal or social work questions in general, please feel free to reach out to us at that number. I always like to tell seniors who I speak to that calling in the morning is the best time to call because sometimes our call lines can get a bit overwhelmed. So if you call early in the morning, like right at 9, you have a better shot of getting in and speaking to someone. If you don't reach someone when you call, please leave your name, your number, and your legal issue on the voicemail so that someone can call you back and give you the help that you need. All right. So, Medicare Part D. Medicare Part D provides prescription drug coverage. And today's discussion is going to focus on Medicare Part D. So, Part D helps you to pay for the medications that you pick up from the pharmacy. And because medications can be expensive, Part D can save beneficiaries thousands of dollars each year. Without prescription drug coverage, some seniors would have to choose between medication, rent, food, or utilities. And that is why any news involving Part D tends to cause a bit of concern because, we don't want them taking away our Medicare medication coverage. So, why is there so much confusion going on? So let's talk about why the confusion developed. So recently, the Centers for Medicare and Medicaid Services announced that it would end a temporary demonstration program. And the Centers for Medicare and Medicaid Services, it's often called CMS. So if you hear me say CMS, that's what I'm referring to. It's a federal agency and they administer Medicare, right? And so many media reports referred to this program as a subsidy. They refer to Medicare Part D. When seniors hear the word subsidy, they often think about extra help, Medicaid, or maybe the QMB or another Medicare savings program. However, that's not what the announcement was about. The subsidy being discussed was a payment made by Medicare to insurance companies. It's not a benefit that's paid directly to you as a senior. And so this distinction is important. So there's nothing that's going away for you. The recent CMS announcement does not eliminate Medicare Part D. All right. It does not eliminate extra help, and it does not eliminate prescription drug coverage. Unfortunately, social media often spreads information more quickly than facts, and that has contributed to some fear and confusion. So today we're going to correct those misconceptions. All right. So the program being discontinued is called the Medicare Part D Premium Stabilization Demonstration Program. And that is a long name, but think about it this way. It's a temporary government program that was created to prevent sudden premium increases. Now, in order to understand why it existed, we need to go back a few years. So in 2022, Congress passed important prescription drug reforms, and these reforms gave Medicare beneficiaries stronger protections. So insurance companies expected these changes would increase their costs. So as a result, many insurers plan substantial premium increases in order to account for those, increase to their costs. The federal government was concerned that the large premium increases would shock seniors, shock beneficiaries, cause people to switch plans, and create instability in the marketplace. So Medicare temporarily provided financial assistance to participating standalone Part D plans. Okay, so the program helped to keep the premiums lower than they would be otherwise. And so the stabilization program was always intended to be temporary. And the CMS has now announced that it's going to end after this year. And so the important thing to remember is the temporary premium assistance to the insurance company is ending, but Medicare Part D itself is not ending. I want to pause there. Oh, one moment. I want to pause there because I see a couple of things in the chat. Okay, great. Thank you for the reminder, Alex. Yes, we're talking about the Medicare Part D Premium Stabilization Demonstration Program that is going to be ending after this year. And we're just talking to ensure that everybody understands that that doesn't mean that Medicare Part D is ending. Your extra help programs are not ending. The Medicare savings programs are not ending. It's just the money that was going to the insurance companies to help the cost of the medications. That is what is ending. Okay, so again, this is probably the most important slide today, so we want to pay attention because this will come up on our quiz. But let's talk about what is going to be available for you as a senior. Okay, so first, you're going to have access to Medicare Part D. If you currently receive prescription drug coverage through Medicare Part D, you're not losing that benefit because of this announcement. Secondly, if you're enrolled in Extra Help, that is also available. And for those who don't know, Extra Help is a federal program that assists eligible low-income Medicare beneficiaries to cover the cost of prescriptions. Third, the Medicare savings programs are also available, and these programs will help you to pay for your Medicare costs. If you have QMB, you know that they cover your Medicare premiums every month, and they also help to cover your copays. If you do not have QMB, or if you notice that when you receive your Social Security benefits every month, that about $202.90 is being taken out for your Medicare premiums, Feel free to contact us at Legal Counsel for the Elderly. We can help you to apply for QMB, or you can go to DHS and do your application in person at one of their DHS service centers. But QMB is a great savings program if you'd like to take advantage of it. Fourth, the Medicare Drug Negotiation Program is also still available. Fifth, the cap that they have on insulin to ensure that it's affordable is also in place. Many beneficiaries continue to benefit from paying no more than $35 per month for their covered insulin. And then sixth, recommended vaccines remain available without cost sharing. So none of these programs are connected to the demonstration program ending. And this is a key message. The pilot program is ending. These consumer protections that are available to you are not ending. Okay, so let's focus on the good news, right? The 2022 law made prescription drugs more affordable for millions of Americans. One of the biggest changes involved out-of-pocket costs, right? Because historically, there was no cap on prescription drugs spending. And some seniors who were living with cancer, multiple sclerosis, rheumatoid arthritis, or another serious condition, they often faced enormous medication cost, right? So now there's a limit. In 2025, annual prescription drug spending was capped at $2,000. This year, the cap is approximately $2,100. So after reaching that limit, you don't have to continue to pay for covered drug costs for the remainder of the year. And to really illustrate that, because I think that is a great, benefit, especially for those of us who are living with serious medical condition. Let's think of a hypothetical person. Let's call her Mary. And let's say Mary has a serious condition, Mary has cancer, and her medications to treat her cancer cost thousands of dollars per year. Before the reforms, Mary might have continued paying significant costs throughout the year. But under this, 2022 improvement, she reaches the annual cap, meaning this year she only has to pay $2,100 on the medication. And then after that, her covered Part D drug costs stop. And so this protection can save you and other beneficiaries thousands of dollars per year. All right, so let's now discuss the area that's receiving some media attention because many experts believe that some standalone Part D plans may increase their premiums in 2027. And notice that I said some plans, right? Because we don't know yet all of the premium amounts for 2027. Insurance companies are still preparing their offerings, and it's important to note that the premium cost is going to vary by your location. It's going to vary by the insurance company that you have, and it's also going to vary by your coverage choice. So not everyone is going to experience the same increase. Some people may see little change. Others may experience a more noticeable increase. Therefore, nobody should make assumptions before actually reviewing your plan information, right? So I also wanted to take some time to review the Extra Help program because it is one of the most valuable Medicare programs. Extra Help is also known as the low income subsidy. And this program helps qualified Medicare beneficiaries pay their monthly premiums, pay for deductibles, and pay for prescription co-payments. And many people qualify and they don't even realize it. So again, if you want to assess your eligibility, If you're not receiving it, feel free to reach out to us at Legal Counsel for the Elderly. We are more than happy to review your eligibility with you. Now, some beneficiaries mistakenly believe that they earn too much, but the eligibility rules became more generous income-wise starting in 2024. So whenever I speak to seniors, I always encourage them to apply if they have limited income and assets, because many people would be surprised that they qualify. And remember, extra help is not going away. It's still available for you. Another important program that may be helpful to you all is, let's see, is the Medicare savings programs. And like we talked about with QMB, they help you to pay your Medicare costs. They help with your Medicare Part B premiums, coinsurance, deductibles. For some beneficiaries, these programs can free up hundreds or even thousands of dollars per year. And I mean, we could all use that extra money in our budget, right? Living here in DC. So, importantly, Medicare savings programs are completely separate from the Part D premium stabilization program. So, nothing in the CMS announcement eliminates these benefits. So, if you're interested in applying, again, reach out to us at Legal Counsel for the Elderly. Okay, so what should you do? Whenever there's a policy change, people will ask, what should I do right now? And the simple answer, first, do not panic. Second, read all of your notices from Medicare and your insurance company. Third, you want to review your annual notice of change because this document explains changes for the coming year to your plan. Fourth, you can always compare plans during open enrollment, and open enrollment should begin this year, October 15th. And many people, they feel comfortable, they stay in their same plan every year. And sometimes that is the right choice, but sometimes it's not. So a plan that had, worked well for you last year may not be the plan for you this year. So you'll want to check the monthly premiums, check what the deductibles will be, see if they cover your medications, see what pharmacies are in network, because if you have a pharmacy that you like to go to, you want to make sure that your plan is going to cover that. And finally, every year, screen for extra help and the Medicare savings programs to ensure if you're eligible, you apply, just like we renew or recertify for SNAP, Medicaid, you do have to recertify for QMB. If you need assistance with that, again, reach out to us at Legal Counsel for the Elderly. All right, so before we jump into our quiz to ensure that we have a handle on the information, I want to just share some takeaways. Okay, so the most important thing to remember is that Medicare Part D is not ending, right? Extra help is not ending. The Medicare savings programs are not ending. The prescription drug protections that were created by the 2022 law is available to you. Some Part D premiums may increase, but it's important to know that open enrollment is important because that's the time where you can look at your plan, compare other plans, and see which one works for you. So those are the key takeaways that I want to leave you all with. And now I want to ask for a volunteer who can come off of mute and read the question for all of us. And then after they read the question, I want to ask if we can practice our tech skills, and everyone, please put your answer into the chat. We're going to move through about 5 or 6 questions. asking for a volunteer on each question, and then we'll review them at the end together. So feel free to come off mute. Anyone who would like to read the first question for us, please.
Hello.
Hello.
Hello, Miss Robin.
Thank you for
Medicare
volunteer.
Part D knowledge check. True or false? Medicare Part D prescription drug coverage is ending in 2027. True or false?
All right. Let's take a moment to put our answer in the chat. All right, I see a few answers coming in. I want to pause and give everyone, there's about 30 of us online today. I'm going to pause and give everyone an opportunity to put their answer in the chat. All right, we have about 8 responses out of 30. We'll wait a little bit more to give everyone an opportunity to answer question 1. All right, thank you to those who have answered in the chat. If you haven't submitted your answer yet, there's still time. True or false? All right, thank you all. Now, can I ask for a volunteer to come off mute and read our second question?
I will.
Thank you.
Number 2, the premium stabilization program primarily benefited A, hospitals, B, insurance companies offering standalone Part D plans, C, Social Security offices, D, pharmacies.
Thank you. All right, let's take a moment and practice our tech skills and put our answer in the chat.
Premium. Premium program.
Thank you to everyone who's answered so far. You still have time if you'd like to enter your answer to question 2 in the chat. Okay, thank you all for your answers. Now, may I have a volunteer to read our third question?
Okay. True or false? Extra help is ending because the premium stabilization program is ending. True or false?
Thank you so much. All right, so let's take a moment to enter our answers in the chat. Okay. Thank you to everyone who has answered. We have about 7 answers in the chat. I'm going to pause to give others an opportunity to practice their technology skills and enter your answer in the chat. All right. Question 4. Can we have a volunteer to read question 4 for us?
Sure, I'll read it.
Thank you.
Which program helps eligible beneficiaries pay Part D premiums, deductibles, and copays? A, Medicaid buy-in. B, Medicare savings program. C, extra help. D, Medigap.
Yes, thank you so much. So take a moment and place your answer in the chat. Thank you to everyone who entered your answer. We have about 12 answers, but there's still time if you want to put your answer in the chat. Which program helps eligible beneficiaries pay Part D premiums, deductibles, and copays? All right. All right. Can we have a volunteer for question number 5?
What happens when a beneficiary reaches the annual Part D out of pocket cap? A, premiums double. B, drug costs continue normally. C, they stop paying covered prescription drug costs for the remainder of the year. Or D, Medicare ends coverage.
Thank you, Mr. Thompson. All right. I see some answers in the chat. Everyone, feel free to join in and put your answer in the chat. right. Keep those answers coming. Thank you all so much for your engagement. Our hope is that this information is helpful. As we said, open enrollment is coming up in October. So hopefully this will help you to feel informed so you can choose the right plan for you. All right. And we are to our last question. Can I get a volunteer for our last question?
What should beneficiaries do during open enrollment? A, ignore plan notices, compare available plans. C, assume their current plan remains the best option. D, cancel Part D.
Thank you. Thank you so much. Okay, so let's take a moment and put our answers in the chat. Keep those answers coming. There's still time. What should we do during open enrollment? Okay, and I see a question. Miss Webb is asking, what was the first question? So let's go ahead and go back, Miss Webb. So the first question is a Medicare Part D knowledge check. They want to know true or false. Medicare Part D prescription drug coverage is ending in 2027. Is that true or is that false? All
Thank you.
right. Of course, of course. Oh, okay. And last chance for you to enter your answer for question 6. What should beneficiaries do during open enrollment? Okay. So I want to take a moment to go back over some important parts before we get points before we get to the answer. The most important messages from the presentation today is number 1, Medicare Part D is not ending. Number 2, extra help is not ending. Number 3, Medicare savings programs are not ending. Number 4, the annual prescription drug out-of-pocket cap remains in place for your protection. 5, some standalone Part D plans may experience premium increases. And 6, open enrollment is the best time to review your options and make sure that your plan continues to meet your needs. Okay, so now let's go back and we will answer the questions together. So first of all, great job to all of you who answered B on this question. Great job because as you could see, the coverage is not ending. We discussed that and you all got that correct. That was a misconception after people saw the headlines, but that is simply not true. Medicare Part D is the prescription drug portion of Medicare and it will continue to exist. You'll still be able to obtain your prescription drug coverage through Medicare Part D. Now, what is ending is the temporary program that helped keep premiums lower for certain standalone Part D plans. The prescription coverage itself is not disappearing. So, I think it would be helpful if this is just a moment of engagement. If you want to come off of mute and say this with me, the pilot program is ending. Medicare Part D is not ending. Can we say that together? Because I just want to make sure we all get that. The pilot program is
It's
ending.
ending.
Medicare
Medicare
Part
Part
D
D
is
is
not
not
ending.
ending.
Thank you so much. Okay, so I want to see if we have any volunteers. Can anybody tell me why that's important for us to understand that difference?
I can't get to it.
Well, Part D is your prescription. You don't want that to end. So,
Right, right.
yeah.
Excellent observation. Understanding that distinction helps us, not to make decisions out of fear and to have the fact that we are going to have our prescriptions covered through Medicare Part D. So great job. All right. So for question 2, um, great job to everyone who answered B. B was the correct answer. Insurance companies offering standalone Medicare Part D plans. So this question helps us to understand why there has been so much confusion. The subsidy being discussed in the news was not sent directly to you or to other seniors. The money went to insurance companies that offered standalone Part D plans. So the goal was to help those companies to adjust to changes and the Medicare drug coverage and to help them avoid significant premium increases. So think about it this way. The federal government temporarily provided support to stabilize the market. So the support was intended to prevent very large premium increases where insurance companies adjusted to new rules. So when you hear people say the word subsidy, they often think about money that they're receiving personally, but that's not the case here. The subsidy was aimed at stabilizing the insurance companies, not providing direct cash to seniors or beneficiaries.
Right.
Yes,
Robin, I was going to say that I think a lot of times the newspaper reporters don't understand the programs themselves, so they write their articles in a way that misinformation is conveyed because they
that
themselves don't know the ins and outs.
That's correct. And that's why I'm so grateful to you all allowing me to come and speak to you today, just so we could talk and we can go over everything to make sure everyone knows that you still have your Medicare Part D premiums and we understand the distinction. All right. So for question 3, the correct answer is false. Extra help again remains available. I can't emphasize that enough. One of the reasons that many organizations, including AARP and legal service programs across the country, have been discussing this issue is because some seniors have become worried that extra help is going away. Extra help is still available. Extra help exists. It assists you and eligible Medicare beneficiaries by helping pay for prescription drug cost premiums. And the announcement wasn't about eliminating extra help. So I want to kind of take the temperature of the room and give us an opportunity to practice using our hand raising button that Alex told us about in the beginning. If you heard the rumor that extra help was ending, or if you read an article, or if you saw it on social media, can you raise your hand just so we can get a sense of like, was this an issue or was it a not an issue? Did anybody hear that extra help was going away? Okay, 2 hands, 3 hands. Okay. Well, even with three hands, that means that, this presentation was needed today, and it was good that we came, you and I, all of us can have a conversation so that we can get on the same page and everyone can have the correct information. All right. So if you chose option C, pat yourself on the back. And then let's take a moment to talk about the difference between extra help and the Medicare savings programs, because people often mix them up. Extra help focuses on prescription drug costs. Think Part D equals drugs. And so extra helps with prescription drug premiums, prescription drug deductibles, prescription drug copayments. Medicare saving programs are different. Those programs often help with Medicare Part B cost and certain Medicare expenses. A simple memory trick is this: extra helps with drug costs. Medicare savings programs primarily help with Medicare costs. Sometimes people qualify for both programs, which can result in substantial savings. An example would be if a beneficiary had limited income, they may qualify for extra help to reduce their prescription costs. And at the same time, they qualify for Medicare savings program that pays their Medicare Part D premium. So using both programs could save hundreds or even thousands of dollars annually. All right. So if you chose C for question 5, you deserve a round of applause because this is actually one of the most important consumer protections created by the 2022 prescription drug law. Before these reforms, some people, again, like we said, they continued paying significant drug costs throughout the year. There was no meaningful limit for many beneficiaries with expensive medical conditions. Today, after beneficiaries reach the annual Part D out-of-pocket cap, they do not continue paying covered prescription costs for the rest of that year. That protection can be life-changing. And again, we gave an example earlier, but think about an individual or a senior who requires some kind of specialty medication. Those medications can sometimes cost thousands of dollars. And so the annual cap protects that individual from the endless out-of-pocket spending. This, change provides major financial relief for many Medicare beneficiaries. And great job if you chose C. And our last question, the correct answer is B. And I think I saw a lot of you got that correct. You'll want to compare the plans. If there is one action I hope everyone takes from today's talk, it is this one. Open enrollment begins in October. Many beneficiaries remain in the same plan every year, and if that is what works for you, great. But if you can save money by looking at other plans, you may want to just compare the premium costs, the deductibles, the drug, cost. You can also look at what pharmacies are in network for your program, because some premiums may increase for some standalone Part D plans, but you can review your options this year to see where your plan stands.
Mhm. Robin,
So,
I have a question. Would you go back to
yes,
number 5 again?
5, yes.
Now, in order to qualify for this, do you apply once you've reached the max, your cap? Can you apply then, or do you have to apply ahead of time when you
Right.
reach the out-of-pocket cap?
Right. So it's an automatic cap. So if the drug, if the medications that you are getting are covered under Part D and the cost reaches the 2,100 cap, then automatically next time you go to the pharmacy, there shouldn't be a copayment or an outside cost for
No.
that covered drug because, again, your max that you should pay in the year is 2,100.
Okay, so you don't have to do anything.
Correct.
Mm-hmm.
Correct. And I see a question in the chat about 2,000 versus 20,000. Yeah, 2,100 is a lot better than 20,000. Some of these drugs can be very expensive. And then Miss Johnson is asking, are these standalone programs subsidies of Medicare? So some of these standalone programs, they're it's a part of Medicare because today we're talking about Medicare Part D. So it's a part of Medicare rather than a subsidy. And the extra help can help you with saving money on prescriptions. And the Medicare savings programs can help you to save money on Medicare, like Part D, premiums, um, and copays.
Mm-hmm.
So I
Now, is
want to
that income based when they stop charging you for the rest of the year? Do you have to qualify within a certain income limit?
That's a great question. So the Medicare Part D cap is not income-based, but extra help, and the Medicare savings programs are.
Okay.
Yes. All right. So I want to pause here. Thank you to Alex who put our number in the chat. I wanted to pause here and make sure that you all um, had our number if you want to reach out to us to get more information about Medicare Part D. And I see we have a hand raised.
Hi, Ms. Doris, you have a question?
I have a question and I want to make a comment because this is
Yeah.
something that I've been experiencing and a lot of people might not be aware of it. I get my prescriptions at Harris Teeter and I always have to call Care First. I have QMB, Care First, and Medicare. Okay, they telling me that Trump's making everybody pay when that's not true in my case. Medicare pay 80%. Care First pay the other 20%. So they've been charging me for the last 2 years money on some prescriptions, which I should not have to pay. I have to always call Care First for them to train them how to run it through the system. So now I got 2 years, which I'm not complaining because that's money coming back to me that I got to fill out in order to be reimbursed for that because they've been putting it in the system wrong. So a lot of people might not be aware of it, but you have to sometimes check with the secondary person to tell them how to run it through the system because they just been running it through Medicare and charging me money that I shouldn't have been paying. And then the question I wanted to ask you is, do your Medicare card supposed to show D on it? Because I got A, B, and I don't have D on there. And that's a lot of times where I've been getting charged. So they owe me a good bit of money for 2 years because they've been running it through wrong.
First, I want to acknowledge how you advocated for yourself and you followed up with the pharmacy and you also, I think I heard you say you followed up with Care First to make sure that you get that money reimbursed. When you go to the pharmacy or if you go to your medical provider, if you have Medicare and Medicaid or QMB, you want to make sure you always present all of your medical providers. So like you said, they will charge all of them so that there are no out-of-pocket costs to you. Now, with the Medicare Part D card, if you have Medicare Part D, you should have a card that states so, Medicare Part D or prescription card. If you don't have that, you could call Medicare and ask them to send you a copy of that card. They usually can mail one out to you in 4 weeks, or if you need one immediately, I believe they can either email one to you that you can like print out and bring with you the next time you go to the pharmacy. And
Yeah,
if
because
you meet,
I have to train them how to run it through, and they don't listen to me. So
mm,
now, Care First, I called them, and they called the store and trained them how to do it the way I've been explaining it to them.
yeah. Well, great job advocating for yourself. I think that is wonderful. And if I were you, I would call Medicare so you can get a copy of that Medicare Part D card. And I have to tell you all, I've been having so much fun. I didn't even notice the time. 2:30 just crept up on us, and you
Yeah,
guys were so involved with the quiz and with sharing your experiences. I really enjoyed the presentation with you today. And I have great news. Lillian is going to be here next month. She's a part of our Medicare Senior Patrol, and she's going to give you more information so that when open enrollment comes in October, you're ready to go. So she'll be here with you next month. Miss Jackson,
Yep, I think we have time for one more question today. Thank you.
Hey,
how are
I wanted
you?
to tell you, I attend this DC Medicaid meeting, and it comes on Wednesdays. Well, this one was Friday, August the 14th, but they come out every other Wednesday. It's for all the DC Medicaid, Medicare, whoever's in the programs. And they give you all the information, and you can ask questions about everything you just talked about. And it lasts for an hour. Come on, like 2:30, sometimes 6:30. It depends what the meeting is, but you have to register for the meeting. And it said DC resident, let's talk about changes. And they was talking about people might had to work or something or whatever. They talk about that. They talk about your premiums, who get what, and how much your income have to be to, it'd be a lot of people on there. It's in the website, but it's not through the Zoom. It's through that other website. What is it? WEB, something like that. That
Right.
website. But it'd be quite a few people on there, and they talk about all this you talking about. And you can ask questions, and yeah, it's real good. It came on everybody's phone one
Thank you
time.
for thank you for sharing that information. Alex, is it okay if I put the link in the chat for that meeting in case anyone wants to join?
Oh, that is okay.
Okay. So we're going to put the
Yeah,
link
so
to
you
that
aware of
meeting.
what I'm talking about, right?
Yes, they provide
Yeah.
helpful information.
Mm-hmm.
So if anyone wants to go, or if they have questions, or even if you have a similar situation where your provider is not accepting your insurance or something is going on with how they process it, if they can't help you in the meeting, they'll tell you who to email and follow up with afterwards.
Right. But you
Thank
do
you, Miss
have to go,
Jackson.
but you do have to go to the website of it
Okay,
to attend the meeting.
thank you.
You. Thank you,
Thank you for
Robin, so
letting me
much.
share.
And thank you,
Yes.
Denise, for sharing.
Mm-hmm.
All right. Well, I hope you all have a good afternoon. Thank you again for allowing me to be here. And like I said, Lillian will be here next month to share more information about Medicare and get you all prepared for open enrollment.
Oh, thank you so much, Robin, for being here. We appreciate you and your information, and you have the chat going. I love it. And
I'm
everyone,
trying to get like you. You always have the
oh.
chat going and everything. So
But I see all the participation, so I hope this was helpful for everyone. So make sure you fill out the poll. But let's all say a big thank you to Robin for presenting today, and we'll see you guys next month.
Thank you, Miss Robin.
Thank
thank
you.
you.
Thank
Take
you.
care.
Thank
Thank
you,
you.
Robin.
Thanks, Robin. Mr. Alex.
Thank you,
Thank
Robin.
you so much.
Thank you, Alex.
Robin, have
Don't
a good
forget to
week.
go to the